Hello and welcome. I'm Dr. Randall Duthler. I'm one of the owners and founders of ADHD Online. I'd like to welcome you to one of our weekly webinars where we focus on ADHD. Tonight we're going to be focusing on ADHD and anxiety. So this is a very common problem. We really hope that this is helpful for you and for those you know that are suffering from anxiety or ADHD. All right, so just a basic disclosure here. So I am a physician, but I'm not your physician. So definitely make sure that you discuss any medication changes with your doctor before moving forward with any of those things. A couple of things, if you've not done a webinar with Zoom before, there's a couple of things that, that you can do. There are chat features that are sometimes available, as well as a question and answer section that we'll get to at the end. So make sure that you go ahead and submit those questions along the way. And then as I'm done with the presentation, we'll be able to take some time and go over some of those questions together. All right, so let's move forward here. So a couple of things just about mental health in general. So one of the things I always tell my students is that there is no such thing as a normal person. And I've been in practice for years. I've never met a normal person. And so that's really important to know starting out when we talk about mental health, is that that is not the goal. The goal is not to make you normal, because that just doesn't exist. The other really important thing is that mental health diagnoses in general are really just an exaggeration of normal. And what I mean by that is that everyone has periods of anxiety. Everybody feels depressed. Everybody has a little of their quirky OCD tendencies or things like that. And so where we start to talk about pathology is when those tendencies start to interfere with our daily function. When those tendencies start to interrupt our personal or professional life, that's when we start to intervene, and that's where we start to make a diagnosis, okay? The other thing about mental health is I just want to address the misinformation that's out there. You know, there has been a lot of stigma attached to mental health over the years, and we need to start breaking down those barriers. We need to start having some really honest discussions about mental health. And so kudos to all of you for taking time out of your busy day to come and learn about anxiety and ADHD. This is the first step when we start educating. We come together as a community and we have questions and answers and we break down those barriers. That's so important. That's one of the things I just love about doing these webinars. So thank you for joining us tonight. Let's talk about one of those things that is very common, commonly misunderstood, and that is the notion that you can just will away mental health. So if any of you have been suffering from anxiety or depression or OCD or any of those things, you've probably heard someone say, well, just get over it, or try to be less anxious, or rationalize it like there's nothing to be nervous about here. Why are you having a panic attack? And that's just not how it works. This is honestly the equivalent of you going up to a diabetic patient and saying, well, have you just thought about making more insulin? It would just be better if you made more insulin. It's just lunacy. So I just want to validate you, if you're listening right now and you've been struggling with these things your whole life, that this is not a made-up condition. There's real pathology behind this, and we're going to talk about some of that tonight. And I really hope at the end of this, you really have some insight into what you've been feeling and also why you're feeling some of those things. So let's jump right in about this. So first of all, what is anxiety? So anxiety is just this feeling of worry, this nervousness, kind of an uneasiness that just persists throughout the day. It's almost like you feel like something terrible is going to happen all the time, or this constant fight or flight response that people will describe. And that is what anxiety really is. Now, of course, there's varying degrees of this. It could just be a very mild, unsettled feeling up to a full panic disorder. So again, to make a diagnosis of this doesn't necessarily mean that you have to have some degree of symptoms. It just means, you know, that that you are feeling this on a more persistent basis, okay? So anxiety is also the most common mental health disorder in the United States. And if you're suffering from this, maybe that's validating to know that you're definitely not alone. This is an extremely common and misunderstood condition that affects a lot of people throughout their lifetime. So there's some different forms of anxiety, believe it or not. So the most common one we think of is generalized anxiety disorder. And this is where we just have these persisting symptoms of anxiety more than 6 months that interfere with our daily function. Now, a subset of that is a panic disorder. Now, that's when we have these eruptions of anxiety, I guess I would call them. And these are debilitating episodes that typically last 15 to 20 minutes or so. And, they can simulate heart attacks. They can make you feel like you can't breathe. They really are quite debilitating. Now, situational anxiety is a little bit different. Now, this is different than a normal phobia. We're going to get to that at the bottom here. A situational anxiety is more of a very predictable kind of thing. For instance, let's say you had to do a lot of public speaking, and every time you get up there on stage, your nerves get to you. That's a situational type of anxiety. There's also social anxiety, which is very similar to this. Social anxiety isn't necessarily when you're in the spotlight, it's just being around other people, large groups of people, interacting with people that causes some anxiety. And then there are the phobias. Now, everyone has a phobia, of course. You couldn't drag me onto a ladder, but there are, some more severe phobias, and some of those can, again, start to affect your daily life. An example of that would be maybe you have a fear of flying, but you're a salesperson and have to fly on a regular basis. That's where we would intervene medically to help you get over that phobia so you could live a more functional life and get on with your career. So we talked a little bit about the symptoms of anxiety here and the panic attacks, but in addition to your normal symptoms of anxiety, there are also some other symptoms that can go along with this. And we're going to dive into what we call comorbidities in just a little while here. But one of those things is this feeling of depression. Anxiety and depression work very closely with one another, and they have the same pathology, and that's why. And we'll dive into what that pathology looks like. Insomnia also, very, very common issue with anxiety. When you're busy during the day, maybe you're able to will it away, or you're able to not focus on it as much because you're so busy. And then when night comes, that's when everything slows down. You start running the list in your mind, and that's when it can catch up to you. So insomnia related to anxiety is a very, very common comorbidity. So what causes anxiety? What causes anxiety is a depletion of serotonin. Serotonin is a neurotransmitter that is located in the brain. And what makes this difficult is it cannot be measured. So we know the cause of anxiety, but we can't quantify it. And that is a struggle for a lot of people. We like our data, don't we? We like to be able to measure things. We like our metrics. We like our scales. We like it for the diagnosis. We like it to see how we're progressing as we treat. And when we're talking about anxiety, we don't have the benefit of any kind of measurable number. And so while we know the pathology, we don't have a way to measure it. And so that's why, like a lot of other mental health issues, a lot of it comes down to the story, your history, and what you've gone through in the past and other treatment options that you've explored in the past. But, it's helpful to know what causes this. And we're going to dive in a little bit to what causes the serotonin levels to be depleted. And this is actually a pretty long list here. So one of the more common ones is just prolonged emotional stress. So, let's say you've had job loss, or everyone's dealing with COVID right now. That over time can deplete your serotonin levels. Physical stress can do it. So if you have, some chronic health conditions, malnutrition, lack of sleep, believe it or not, lack of exercise can be one of those things. You hear about people talking about how their endorphins get flowing when they exercise. There's actually some truth to that regular exercise can offer some benefit for both anxiety and depression. But again, the chronic health conditions is another one too. So, very commonly we'll see people that have, suffered a stroke or a heart attack, or been diagnosed with cancer or some other condition that's chronic in nature. And that will definitely deplete serotonin levels. There's also a genetic component to this. And so very, very often when I talk to patients about their anxiety and depression, and I start questioning them about their family history, there's almost always someone else in the family that has suffered from anxiety and depression. So we definitely know that there is a hereditary component to this. But unlike some other genetic conditions, there isn't a clear pattern of heredity. And for that reason, we can't clearly map out who is going to suffer from anxiety in the family. All we can say is that there is a higher risk if there's a strong family history, okay? Now, if you have a child that you're worried about, and you suffer from anxiety and depression, definitely keep a close eye on that child and really open a dialogue about what those symptoms look like. And don't be afraid to get them involved in treatment or counseling or something really early on, because those kids can learn some of the skills necessary to treat and manage anxiety and depression through therapy. They can learn those defense mechanisms, gain some insight into some of the cycles that trigger those symptoms. And you can arm them with a lot of knowledge that will help them over time. So again, if this is something you're worried about in a child, definitely early intervention. Definitely consider that. So again, we talked about the comorbid conditions. OCD is one that we did not cover. OCD is one that really likes to hang out with anxiety. It likes to hold hands with depression, and it is seen a lot with ADHD. So if this was a live seminar, I'm sure I'd be seeing a lot of nodding heads out there as far as OCD goes. But one other comorbid condition that is very often missed when we talk about anxiety is ADHD. Okay. ADHD is very, very, very misunderstood. I think, for a lot of us, we think of only children with ADHD. And I can't tell you how many times one of our psychologists has assessed an adult, and it turns out they've been dealing with anxiety or dealing with ADHD their entire lives. They didn't know it. And then when we start to outline what that looks like, it's like a light bulb goes on, and all of a sudden everything is explained, and there it is. It's actually fairly prevalent. So when we look at the prevalence in adults, age 18 to 44, we're about 8.1%. And just last time it was measured, I think it was 2013, it was 4.4. This 8.1% comes from a 2017 study. So it actually is fairly common. And to be honest, I think we're underdiagnosing this and under assessing for ADHD. So I personally believe that number is a lot higher than 8.1. So there's actually different forms of ADHD. And one thing that is a common misunderstanding is ADD. So we used to differentiate between ADD and ADHD, and we've gotten rid of the ADD. That's gone now. And so now we call that an ADHD inattentive. And so that's the new ADD. And then there's also ADHD hyperactive and ADHD combined. Now there's some other subset ones, but these are the three main diagnoses of ADHD. So the inattentive symptoms are usually pretty clear in adults, and it's the standard ones. It's just, difficulty sustaining attention. Maybe a couple of you are onto other tasks or multitasking now as you watch this, but that's not uncommon at all. So difficulty just sustaining attention. These are the people that are up during a movie at home and, they can't sit still for more than an hour. Lack of attention to detail is also another one that's very, very common. But one of my favorite ones to talk about is the unfinished projects. And so when you have ADHD, the excitement of a new project is captivating, isn't it? You're getting ready to get this project off the ground. It's exciting, it's new, and you get halfway through it, and then the project becomes boring. It just kind of drones on. And so then the new project starts, the new idea pops into your head and you're off on that one. And what you end up having is multiple half-finished projects all over. This can affect your professional life as well, because, when the project is difficult and it's hard to get through, it's much easier to veer away from that, be distracted by something else. And so that's where we end up with missed deadlines and other things, a really common problem. Difficulty following instructions, and to be honest, half the time it's because you don't hear them all. You get the first three or you don't read the instructions is a common thing as well. We talked about distraction, the forgetfulness as well. And this one, the misplaced possessions, is just classic. So I don't know how many of you are spending the morning looking for your car keys or wallet or chargers or whatever else you're looking for, but that's a really common thing with adult ADHD. Now, the hyperactive symptoms with adults is much, much different than with children. When we talk about a hyperactive child, what we're imagining is this kid who's just bouncing off the walls, tons of energy. We always say kind of driven by a motor, and that's your typical child. But adults it's different. So for adults, it's this impatience, right? So your mind is going faster than the surroundings. So it's hard for you to be patient and wait for other people to engage. Right? When you have conversations with people, sometimes you just listen for your turn to talk. You're not actually hearing them. You're just listening as a cue to talk. Impulsiveness is another one too. Sometimes, we buy things impulsively or we make decisions impulsively. That's a common one. Fidgeting, we do see that in adults and children, usually a little less pronounced in adults. It's more like the rolling pencil or the tapping or something like that. It's not necessarily squirming in our seats like we see with kids. This one is one that I love to talk about because it's kind of a light bulb with people, and that is intrusions into conversations. That actually falls under one of the hyperactive symptoms for adults. So imagine you're at the movie theater, you hear someone behind you talking about some topic that interests you. The next thing you know, you've turned around, you're engaging them in conversation, and you don't know them. So that's a common symptom, is this intrusion into conversation. Sometimes we'll see a low frustration tolerance as well. And this kind of hinges alongside this impulsiveness, right? So the short fuse is common. But then the anxiety, this feeling of restlessness, this feeling of anxiety is another common symptom of ADHD. And we're going to dive into why that is here very shortly. So why does ADHD mimic anxiety? Well, the very first thing is that ADHD, when it's uncontrolled or undiagnosed for that matter, it just creates a world of chaos. People are late for appointments all the time. They fail to show up at all. You know, I always tell my nurses to have some grace when it comes to my ADHD patients because it's hard to stay on time. And so oftentimes they are a little bit later. We do get that refill request at 4:55 on a Friday. And that's just the nature of uncontrolled ADHD. But living like that does provoke some anxiety because everything seems like it's always out of control. Everything is chaotic. You know, this also leaks into the professional world with these missed deadlines, sometimes being late for meetings or other things. You know, that can affect your professional life. And now you're being passed up for promotions or you're, you know, having a conversation with your boss that's uncomfortable. Again, these projects that can be difficult to finish, that can affect your personal and professional life. And then, you know, some of the social faux pas as well, not just interrupting in conversations in, you know, the outside world in public, but also maybe missing some of those social cues in your professional or social life is another issue. And then, of course, you know, the aftermath of that can certainly be very anxiety provoking. But I think the number one thing that causes anxiety symptoms for patients is just this, for ADHD patients, is just this sense of chaos. You know, this constant thought tornado that is a result of ADHD. So this is why you're here. This is the meat of the webinar, isn't it? So how do you tell the difference between ADHD and anxiety? And the distinction can be extremely difficult to make, even for physicians and other mental health professionals. Making the distinction can be very, very difficult. But some guidelines to start with. So generalized anxiety just tends to be more persistent all the time. It's always there, you know, more days than not. It's just this constant state of anxiety. With ADHD, it's a little bit different. So that one's often associated with the aftermath of the missed appointments, the missed deadlines, the chaos, all those types of things. And so this fear of, am I going to be late for this meeting? Did I forget something? You know, this constant feeling with ADHD that you've forgotten something really important could be anxiety provoking. And so with ADHD, it does tend to be a little bit more situational than generalized anxiety. Now, that's not always the case, but that's definitely a clue and something that I ask patients about as we're starting to take a history. You know, how does your anxiety rear its head? What is the scenario in which you feel these symptoms of anxiety? Now, again, there are some social subsets of anxiety that are unrelated to ADHD. But again, these are more specific social triggers, being out in crowds, giving a speech, something like that. So that's the differentiation. With anxiety related to ADHD, it's oftentimes a direct correlation to some problem related to your inattention or impulsivity or hyperactivity. So the other thing we look at are past treatment failures. You know, this can be really, really helpful. People get frustrated when they've taken a medication and it hasn't been helpful. But to be honest, treatments can be both therapeutic and diagnostic. Now, remember, we can't measure serotonin levels. And because we can't measure serotonin levels, we're looking for other metrics, other ways to gauge our therapy and help us with the diagnosis. And so one of the mainstays of treatment for anxiety are the SSRI and the SNRI classes. Now, we name these antidepressants, but in truth, their real name is selective serotonin reuptake inhibitor or selective norepinephrine reuptake inhibitor. So these medications, nobody can remember these names, so we just call them antidepressants. But what these medications do is they slowly increase your own levels of serotonin. And these medications are quite insidious. So when you take it, it's not like a Tylenol, 15 minutes later you feel better. It takes a few weeks to start to work. But But patients who are suffering from anxiety, depression, or OCD related to serotonin levels being low will often see improvement with the addition of these medications. Now, you may be familiar with some of these medications. Examples would be Zoloft or Prozac or Lexapro, Celexa, Paxil. There's a bunch of them out there. The SNRI class of medications are Cymbalta and Effexor, just a couple of those. Now, in addition to those, there are the benzodiazepines. Now, for generalized anxiety disorder, the SSRI class medications, they treat the underlying problem, and over the course of weeks, it gets better, and that's the mainstay of treatment. The benzodiazepine class is one that's often used for anxiety, but its role is often misunderstood, and I really want to take a minute to educate you about this if you're taking this type of medication. So benzodiazepines are sedatives, and their role is to temporarily relieve symptoms of anxiety. Now, they just mask the symptoms of anxiety. So this would be as if you imagine you had a broken bone and you came into the hospital, and the hospital, gave you a strong pain medication and you started to feel better. That bone is not healed, but you feel better because you were given a pain medication, right? We temporarily mask the symptoms, but the problem is very much still there. When we give benzodiazepine medications, we're not fixing the problem. What we're doing is we're fixing this short term, we're relieving the symptoms until we can fix the problem. And that's why we oftentimes will give these alongside some of these SSRI medications. So examples of the benzodiazepines include the Xanax medication, Klonopin, Ativan, Valium. One problem with the benzodiazepines is if you take them by themselves, it's called monotherapy, and you don't take it with something else, over time, these medications will begin to provoke your symptoms of anxiety. And so long-term, this can be part of the problem. And as we start to dive into the anxiety and determine whether this is ADHD or anxiety, don't be surprised if your clinician is trying to wean you away from these benzodiazepines. They really muddy the water when you talk about making a diagnosis, and long-term, again, they can cause some problems. But the other thing that we look at is whether or not we've given a medication accidentally or incidentally that would also treat ADHD. So many medications are used what's called off-label for ADHD. So a couple of examples. Wellbutrin is a medication. Its other name is Zyban. We use it for smoking cessation. It treats agitated depression, and it also treats ADHD. Indirel is an interesting medication. It's a hypertensive medication or antihypertensive. It also treats situational anxiety. Incidentally, it treats migraine headaches and ADHD. Clonidine is another one. It's a hypertensive drug, but it helps with impulsivity issues related to ADHD. So if we find that you've taken these medications for other reasons, and then you say, hey, you know what? While I was taking that, now that you mention it, I was feeling better. My anxiety was less. I felt more organized. I felt better overall. That may suggest that maybe this is ADHD. So that can give us some clues into the diagnosis. So the biggest thing to do is to consider an assessment. And this is why assessments are helpful. When we do a full assessment, we're actually looking at all of the symptoms that could mimic ADHD. We're addressing anxiety, we're addressing depression, we're looking at OCD, we're looking at PTSD, we're looking at gifted status for our youngsters. We're looking at all the things that can mimic ADHD, because that's actually one of the key diagnostic criteria for ADHD is, can we explain this with another diagnosis better? And if you can, then it's not ADHD. And so a formal assessment can really give us a lot of insight into what is going on, and can help us solidify a diagnosis of ADHD. This is so much so that actually almost all physicians will require a formal diagnosis by a psychologist before they'll even consider discussing medications with you. And so there is a lot of value in having that done. Now, sometimes the results come back as a little bit ambiguous. We aren't entirely sure whether the diagnosis is there. And that can be really frustrating for patients if they don't get a clear answer. In this case, this is when you want to go back to your doctor and say, well, maybe we just treat for ADHD and see how I feel. Because, when you give the medication, honestly, most of the stimulants, within 30 minutes, you're going to know whether you're having some improvement of symptoms. And so that can be, again, both therapeutic and diagnostic, and of great value in patients that are trying to solidify a diagnosis. Now, another thing to consider is that sometimes this can be multifactorial. And so when we're talking about, medical issues, we're always looking for what we call that smoking gun, right? What is the diagnosis? What is the cause? What is the explanation for this? And that gives us some solace in knowing that this was the cause. But it doesn't always work like that. It would be great if when we had one diagnosis, say a diagnosis of depression, that we somehow were immune to other conditions, right? So you can't get anxiety because you have depression, or you can't have OCD because you had anxiety. And that's not how that works. So be prepared to hear that you may have, in truth, both. You could absolutely have generalized anxiety disorder and you could have ADHD. And so this is why it's really important to work with someone who clearly understands the distinction between the two, the pathology between each of these, and the treatment for each of these. Because when you talk about this situation, you're really starting to venture into multiple medications that work together to try to control the symptoms. And so it's important also to have some goals and expectations when it comes to this. So the goal is not to medicate you into a different person, because we've already established there is no normal, didn't we? We established that there's no normal person, and so we can't make you normal. The goal is to improve the symptoms, improve your quality of life, improve your functionality. And maybe we don't totally eliminate those symptoms, but that's okay. We want to make sure that you're actually more functional and doing better. So that's why I tell my patients, I give you permission to be human. When we take medications for things like anxiety or depression, sometimes we get into our minds that, well, now you can't feel anxious, or now you can't feel depressed because you're being treated. Well, that's not true. Everybody can have a rotten day. Everybody can get their cage rattled. Everybody can run into somebody at the store that makes them upset. Everybody can feel anxious about something. That's totally normal. So give yourself permission to be human and have all those normal ranges of feelings. That's really, really important. And then the last thing about expectations is I really love for patients to think about ways that that ADHD gives you an advantage. And I see there's a little typo there. But it's what can ADHD do for you in a positive way? I've never met an emergency room doctor that didn't have ADHD. Every single solitary one of them have ADHD. And to be honest, a lot of lawyers I've met do as well. And that works for them because they're bouncing in and out of rooms, they're juggling multiple things. That's kind of a superpower for them. And so, a lot of people with ADHD are good public speakers. They're very charismatic. A lot of them are entrepreneurs. They have a different vision or a different approach to problem solving. And so, just because we make a diagnosis does not mean that there's some kind of horrible pathology or that you're broken in any way. I would encourage you to really look for the positives in this diagnosis. I always tell the kids that I treat that this is their superpower. And the last question I ask them when they leave my office is if the medications make them smarter. And they all know the answer is no. So much so that if I forget to ask them at the end, they'll call me out on it, because they like to be asked that question. They like to be reminded that this is their superpower and that they're already smart. The medications just make it a little easier to learn. And if you go down the road of medications, seek an expert. Seek an expert that knows what they're doing so that you can have the right type of medication so that you can maintain all those positives of the ADHD, but you can also function in your daily life. Remember, the goal is improvement of the function and to make life just a little bit easier. One other thing to consider in your pursuit of a group is a group that offers multiple options. So, medications are not the only option here. So patients benefit oftentimes from a combination of medications and psychotherapy, or medications and cognitive behavioral therapy. So look for a group that has multiple treatment options that can be tailored to you and your individual needs. That's extremely, extremely important. All right, so we've made it to the end here, and I'm just going to go ahead and close this out, and we're going to get into some questions and answers here. All right, so our first question here is, can I get a copy of the presentation? And the answer to that is yes. So all of these webinars are cataloged on our website. And so you are able to go to our website at any time and you can review the past webinars. And I love this question also because if you have a family member, you viewed this webinar and this really resonates with you and you think, boy, I think my friend or my brother or sister should have seen this, you can send them the link. And of course, these will always be free webinars. The next question is, how do I mention the fact that I think I might have ADHD to my psychiatrist without seeming like I am diagnosing myself? Yeah, this is a great question. First of all, there's no place for pride in medicine. I tell my students that all the time. And so by all means, bring up your questions honestly and openly. I would never tell a patient they can't advocate for themselves. It's extremely important that you do your own research, but with a healthy dose of caution, knowing not all information is available online is correct. But by all means, bring your concerns to your doctor. And if they balk at that or make you feel really poorly about asking that question, then maybe you seek someone that you par with a little bit better. So that I think that's extremely, extremely important that you have those open discussions. Next question is, what is the best way to treat ADHD and bipolar disorder? And could a bipolar disorder be mistaken for ADHD? Yes, absolutely. So bipolar disorder, definitely can. And so, oftentimes when you're suffering from bipolar disorder, you're having some impulsivity issues as well. Now, there are different types of bipolar, type 1 and type 2. Type 1 tends to be more of this impulsive situation. This is the type where, maybe you drive to California on a whim or something like that. But it can be much milder as well. And those impulsive issues can very closely mimic ADHD. And when treated together by someone who knows what they're doing, patients can have a tremendous improvement in their quality of life. So definitely, if you're suffering from bipolar issues and you suspect an underlying ADHD, definitely get that checked out. The next question here is, I'm going to be seeing a psychiatrist to discuss any evaluations. Which questions should I ask them? I think the question I would ask first is, I would ask how they put their assessment together. I think there are some older assessments that are used. Quite oftentimes there are some that have these attention components to them, where you play this video game or some sustained attention thing for a while. And those have been debunked a little bit. When you read the DSM-5, which is the diagnostic criteria for mental health conditions, that's actually not listed as a component to diagnose ADHD. So if they're using some really, really expensive and antiquated type of diagnostic system, you may want to ask them about that, because that can run the cost up significantly. And then I would also ask that person about their experience with ADHD. So they may be a psychiatrist, but maybe that's not their forte. I know when we bring people on to our company, we definitely make sure that they are experts in ADHD and have a passion for it. So ask those questions about their history with that. The next question is, you talked about testing. Would a full day of psychological tests be good for a 10-year-old to find ADHD versus anxiety? So Jennifer, this question is a great question. Oftentimes our kids are not having a productive conversation at the 10th hour. And that's why we have found our online test to be really helpful, because patients are able to start it and stop it, come back to it. They do it from home, and they can type out their answers as short or long as they like. So we oftentimes get much, I would say, more honest and in-depth answers when we do it that way. I think a 10-hour testing session is really not going to be tremendously helpful. Ours is about 60 to 90 minutes in most cases. And by the end of that, I think the kids are pretty much done. So that would be a little overkill, I think. The next question is from Sarah. Which med or meds do you like best for young kids, aged 8 to 10? We have a nervous ADHD child. So, the stimulants are probably the most common form of ADHD treatment for our younger kids. There are some non-stimulant versions. My experience clinically with those has been medications like Strattera are probably not quite as effective. I mean, there's certainly a place for them, but not quite as effective as the stimulant medications. We do typically start with a methylphenidate-based class, and these are medications like Ritalin LA, Focalin, Concerta falls into that classification. That usually is the first-line drug that we use. There are alternatives like Vyvanse and Adderall, but we'll typically step up to those. These medications are weight-based, and in an 8 to 10-year-old child, we can safely dose those medications. And those are great options for kids. We can talk about things like long-acting and short-acting, what happens in the evenings, do we come off during weekends? So much flexibility when we use the stimulant medications. And I like the fact that we find out how the child is going to respond to that pretty quickly. So, there's a pretty short adjustment titration period to figure out what's going to work for them. So, a lot of options. The next question is, can or does CBD help with ADHD or anxiety symptoms? I do think that cannabis does help with, or CBD helps with anxiety. That's been demonstrated, and its safety profile is pretty good. When we talk about THC or marijuana in general, I do veer people away from that for a couple of reasons. It's not a safety issue. I mean, you know, there's a lot of political stuff about cannabis that I personally feel is a little bit unfounded. But I don't recommend it for our younger patients. And the reason is it creates this just sense of complacency, right? You'll hear people say comfortably numb, where they're just okay, just hanging out in mom's basement. Next thing you know, you're 40. And so while these kids need to be out there really gunning for it and working on their career and winning, they're medicated into this state of complacency. So I'm not a big fan of marijuana, but the CBD, I think, particularly in the evenings, I don't have a problem with that at all. The next question comes from Diego. I have been seeing a therapist for 2 years. Good for you. That is fantastic. It takes a while to make progress. We did a lengthy assessment and her suspicions were true. After I started the research, the light bulb illuminated, as you said, and unfortunately my psychiatrist at Kaiser doesn't believe the same as a 50-minute questionnaire. Okay. Let's see, do you have a recommendation to assess this issue? So oftentimes physicians and psychologists will disagree with patients. And again, because there's no number to quantify these things, a lot of it is based on history and opinion. And so, you know, oftentimes people will disagree with the patients and even with other providers. You know, you go for a second opinion and the answer is quite different. So, you know, I would say, you know, if you have a great relationship with this person, you know, over the course of 2 years, you know, starting with an honest discussion about how you feel about this, about how you feel about being prescribed the Prozac and being prescribed the Wellbutrin and how that did for you. But also, sometimes a second opinion can be helpful. Sometimes seeing someone for another assessment or another opinion, I think is totally appropriate. And I can tell you personally as a physician, I'm never offended when my patients go for a second opinion because, you know, you should advocate for yourself. And I'm human. I'm sure there's things that I'm capable of missing. And so by all means, seek a second opinion. And, you know, we have a lot of patients that come to our website specifically for that reason. They want to very quietly get a second opinion, and we don't share your information with anybody. So we don't send those records to your doctor unless you specifically ask us to do that. We don't submit this to your insurance unless you specifically ask us to do that. So again, a second opinion sometimes can be helpful for patients just to get a little different angle. So that's a good choice. The next question is, does ADHD make a learning disability harder, like dyslexia? The answer to that, I think, is yes. So if you're already suffering from those issues and then you have difficulty paying attention to the teacher or taking notes in class just because you're not focused, I think that can make that a little bit more difficult. You know, these are things that we specifically screen for in our assessment. So I'm glad you brought that up. In addition to the learning disabilities, gifted status is one that's commonly ignored. So if you see a child who is expressing symptoms of anxiety or ADHD symptoms, and then when you challenge them with harder work, it all goes away, you could be dealing with a gifted child. And so that's definitely something we want to look into and work closely with the school. You know, if a diagnosis is made, we encourage patients to work with us so we can work with the school to develop an individualized education plan and work on that stuff. The next question is, what meds do you recommend for an adult female with ADHD and generalized anxiety disorder? So, Lindsay, that's a great question. It would depend a little bit on which form of ADHD you had, and then also what specifically your triggers for ADHD or triggers for anxiety were. So, if your anxiety was more situational in nature, or more social in nature, and you also had a milder form of ADHD, Inderal might be a great medication for you. This was marketed as a blood pressure medication. It, to be honest, has a very modest or mild effect on blood pressure. So if you had no history of hypertension, you could still safely take it. But this medication works very, very well for ADHD and then also some forms of generalized anxiety disorder. The other thing also is whether or not these stimulant medications can provoke anxiety. And I feel the answer is no. So in my experience, patients who have been suffering from anxiety that take a stimulant are not having their symptoms of anxiety provoked. So, you could, if you're being treated for anxiety, you could very easily add a stimulant medication to that and see how that affects your symptoms overall. So I think I would start with the INDA route, and then I would also discuss a stimulant medication with your provider as well. The next question, I spoke with my doctor about this issue and they really feel I have anxiety, but I do, which I do, but my mind is always spinning and I feel like I have to move all the time and cannot focus on one thing at a time. How do I go about getting a doctor to test me for both ADHD and anxiety? And you've been on multiple medications and you just want to slow down a little bit and sleep longer. This is fantastic. You're almost reading this out of a textbook for us. Yes, absolutely. You want to have a formal assessment for ADHD. And in that assessment, they will be looking for anxiety and depression and how that affects your functionality and how that plays into how the anxiety and depression relate to one another. So, some patients find that their doctors are a little resistant for them to get an assessment. And so the option is to self-refer, which means you can look around town to find a psychologist that offers ADHD testing in your area. And then you can go to their office and request to be tested. Most of the time, insurance companies do not require a referral. So you can just go on your own and do this. This can be a little difficult to do. Access can be limited and sometimes the cost can be a little bit more than you would expect. Ironically, this is actually why we started ADHD Online. So I noticed this issue with just access for patients looking for assessments. That's why we actually started this. A colleague of mine who is a psychologist and I developed this. But any psychologist can do this. We personally use only doctorate level psychologists, so they have to earn their PhD in Psych. So there are different levels of psychology. If you have someone who is not a professional counselor, I would stop for a minute and just ask them what their experience has been with ADHD, make sure they have an expertise in that. If you're seeking a formal evaluation. So I hope you find what you're looking for and hope you get an assessment. So the next question is, if one twin has ADHD, does the other one also have it? Again, there's definitely a hereditary component to this. Boys tend to have it more than girls. And oftentimes when we talk about identical twins, it's very commonplace for us to see twins having very similar medical history. I wouldn't say that it's a for sure thing. As you know, every kid's different. I'll tell you, in my house, what works for my son doesn't work for my daughter and vice versa. So every kid is just a little bit different, but I will tell you there's definitely a hereditary component. And if you're suspicious of it, if one definitely has it and you're suspicious that the other one has it, I think you definitely would have enough ammunition to seek an evaluation. I think we have time for a couple more. These are great questions, so let's just keep going. Is there a connection between untreated ADHD and eating disorders and obesity? I don't know necessarily if this would correlate with any eating disorders. This would point me more in the direction of an anxiety or depression issue. Having said that, I do think that there is some history or cases of people who have been suffering from eating disorders and use ADHD medications to treat that. So I do think there's a correlation as far as medications and eating disorders. Some people will abuse ADHD meds for that purpose, but a direct correlation of ADHD and an eating disorder, I'm not sure that I could link those two together very well. If Ritalin didn't help, would another stimulant? Very likely. So a lot of patients do well with Ritalin. Ritalin is of the methylphenidate class. And the methylphenidate class is also the Focalins, is the Concertas. There's a bunch of them out there, Ritalin LAs. But there are medications like Vyvanse and Adderall that I have very, very commonly used that I'm successful with in patients that have failed a methylphenidate or Ritalin-based medication. So definitely do not be discouraged if you failed that medication. There are a lot of other treatment options out there. A lot of it comes down to dosing as well. Knowing how the medications work and finding that right dosing schedule is critically important. And so that's why it's so important to go to someone who knows a lot about ADHD and is comfortable with these medications. The next question is, my son is 11 years old and is diagnosed with ADHD and anxiety. Would you think Concerta is appropriate? And is there any secondary effect? I do think Concerta is appropriate as a first-line drug. We commonly use this medication in children of this age, and I don't know your son's, size or build, but the dose would be dependent on his size and weight. But I definitely think that Concerta is a great option as a first-line medication for children with both the inattentive and hyperactive forms of ADHD. Is there a secondary effect to this? I do think that with patients at that age who are struggling in school, many times we will see anxiety or depression or agitation or acting out result from their struggling academically. So quite often when we medicate these kids and they start to be successful in their academic careers, we see a whole different kid. This is a situation where I would strongly recommend that we do some counseling as well. And that's why at ADHD Online, we also offer the counseling, because many times that's so important, because there can be some psychological trauma associated with struggling. And then what does this diagnosis mean and why am I having this anxiety? What are my triggers for anxiety? What is the cycle? What are some defense mechanisms I can work on to help with my anxiety? And then also working with the schools. We love to work with schools and help them develop individualized education plans. We think that's so important because not every kid is the same. And once you present that document, that proof of diagnosis, that opens the door to these formal IEPs. And so once we get that unlocks that for us, and we can start to work with teachers to give them additional testing time or different ways to learn. So I think those are a couple of things that I would consider. The next one is, how do you tell a psychiatrist that you and your child want to switch to someone else because you're not comfortable with them and their choices? Jennifer, I think that you don't owe an explanation to anyone as to why you would switch. I think that, this is a personal decision. I think that you have to par with this person, and it's not about them, it's about you. I tell my patients that all the time. This visit's about your health. It's not about my ego. And if someone isn't getting what they need from me, I will refer them to someone I think can help, or steer them in the direction of someone I think they would par with a little bit better. So I think just an open, honest discussion and saying, this just isn't working out for us. And you can either ask their opinion for a referral, or you can find one on their own. But definitely don't be afraid to seek the help you need. Their ego can handle it, I promise. The next question comes from Alexandra, and she says, is it weird to not have been offered an ADHD evaluation while having an IEP done? I had one years ago, but my doctor was confused that I was never tested for it with a learning disability. I'm a little surprised about that, to be honest, Alexandra. I do think that is an important component when we're talking about individualized education plans and academic struggles. So yeah, that does make me raise an eyebrow a little bit. And while a lot of times people are diagnosed during childhood, we diagnose a lot of adults. And so it's not too late to seek that evaluation to get some insight into what your symptoms are and where they're coming from. The next question is from Alandra. She says, how accurate is the assessment with individuals who have adjusted to compensating? I've always been an excellent student, but an online student, I've learned I have issues focusing and reading textbooks. It's amazing what we can learn to call normal, isn't it, Alandra? We can learn to compensate in a lot of ways. There was a medical school, and I believe it was the Ohio State University, they had talked about screening all of their incoming students for ADHD because a lot of these kids were very bright. A lot of people with ADHD have very high IQs, and they compensated well until they got to medical school. We always joke, we say, learning in medical school is like trying to drink from a fire hydrant. Just so much information coming at you so quickly. And so whether it's school or a job promotion or something, there's always that line in the sand. There's that threshold where you can't compensate anymore, right? Like all your tricks, all your little things that you do aren't enough anymore, and now you're struggling. And so I think that an assessment in someone like yourself is going to be every bit as valid as it would be in someone who just started to have symptoms of ADHD. Maybe even a little better. You've had some years to gain some insight into this and what you're feeling. If you take your time and really describe those things to the person evaluating you, I do think you would have a valid assessment. And I think there is value in doing that assessment even years later. So yeah, good luck with that. The next question is from Diego. I have difficulty sleeping. I just can't turn my brain off. He's 35 years old. And I feel like even when I sleep 8 or 9 hours, I wake up very tired. And even though I don't wake up once I fall asleep, is this related to ADHD? And do you have any recommendations for it? I think the very first thing would be to address this anxiety issue at night. Now, again, this is the classic scenario where we would try to differentiate between ADHD and anxiety, because anxiety can rear its head in the evenings, but also the aftermath of the what we call ADHD chaos can also rear its head at night. Things that you've missed, things you think you're forgetting, things that are half done, deadlines that you maybe are worried about. So an assessment will help clear some of those things up for you. Another thing to think about, I just saw a little red flag in there where you said you're tired all the time. I don't know what your body type is like, but if you struggled with weight, or you have an issue where maybe you have a little bit shorter neck or airway issue, we would want you to be evaluated for sleep apnea. Many times patients with sleep apnea can have this chronic fatigue issue, memory issues, headaches, brain fog. And so if that sounds like you, I think also, in addition to an assessment, that would be a testing modality we would want to be exploring. So that could be set up by your family physician. So if you have a family doctor, be in touch with them about that. The next question is an anonymous question. And any specific medications you recommend for children diagnosed with ADHD and generalized anxiety? After several attempts of medication, a common side effect was excessive hyperness and aggressiveness. This is not uncommon. Now, what I didn't see you list was the time of this. So sometimes kids, when they're coming off of the medications in the afternoons, that is where this impulsivity will rear its head. That is where we have some oppositional behaviors. Sometimes it could be a medication side effect, or sometimes the kids are doing a really good job of just holding it in at school. And then in the afternoons, we got to let it out. What would be really telling is what happened on the weekends. So if we gave the medications on the weekend and we saw that, great behavior during the mornings, and then we had problems in the afternoon, that would definitely make me think there was a medication issue. Sometimes we will just see some regular oppositional issues with the kids. There is a medication that we will sometimes use. One of them is Intuniv. That one helps quite a bit. It complements a stimulant medication, and it does help with some of those impulsivity issues and oppositional issues. Sometimes clonidine can be also very helpful for impulsive ADHD. It helps tremendously with anxiety as well. That is an adjunct to a stimulant medication and can be used. I don't think that Strattera would be tremendously helpful in this case. And Wellbutrin is not a drug I would recommend in early childhood. So those would be good starting points to discuss with your doctor. Do you typically recommend supplements or other holistic treatments in addition or in place of medication? So Gita, there's one supplement out there that we will sometimes use. Brilia is one. You can Google that and look at it. That one is starting to get some more exposure for an alternative treatment. There are some other things like Mightier has a type of, it's like a video game that helps kids focus and helps also with some of those impulsivity issues and emotional regulation. Those are things we look for. There are some cognitive behavioral therapists that can help with this. That would be an alternative medication. As far as other holistic things, I would explore those with a little bit of caution. What I always tell my patients is that all natural doesn't mean all safe. Cyanide's all natural, lead is all natural, mercury is all natural. We wouldn't need any of those. And so, I think sometimes these supplement companies will capitalize on the idea that all natural is all safe, and they'll put it on the box and lure you into thinking you're taking an effective therapy and B, a safe therapy. So do your research on that and consult with your physician before you explore any of those options. The next one is ADHD treatable without pharmacological intervention. Therapy can be helpful. Also, our webinars are going to explore some things like working with life coaches and organizers and dietitians. So keep track of our webinars going forward, because we're going to explore some of those things that patients can do in addition to medications or in lieu of medications to treat their ADHD. What type of therapy do you recommend for younger children with a diagnosis of ADHD? It depends on the age. I'm very hesitant to medicate kids much younger than 6. Usually we'll wait until kids are probably second grade-ish before we consider medications. First line therapy for them is generally like a Concerta medication or a Ritalin-based medication. These are nice because they're easily dosed by weight, and sometimes they're available in a liquid form. So if you have a child that struggles with taking pills, that's an option. Additionally, some of these medications like Concerta can be opened and sprinkled on pudding or applesauce and taken very easily without a fight. So those are usually the first line treatments that we use in our younger kids. Next one, do all schools recognize ADHD as a need for special service, or do they have other qualifying needs like speech and writing, et cetera? Amy, I love your question. Many times we will work directly with schools, and I will tell you that nationwide our assessment has been, and proof of diagnosis has been accepted. And most of the time schools are very, very amenable to these IEPs. There is a little bit of legwork on their end to be done, but oftentimes they get funding for these. And so I rarely run into a teacher who's not amenable to these. And let's be honest, teachers are wonderful people. I love teachers. They are in it to help kids. A lot of teachers are just willing to bend over backwards to help those kiddos. And again, the assessment and proof of diagnosis unlocks the door to many of the services they want to offer your child. And so I definitely think an assessment is absolutely worthwhile if you're looking into an individualized education plan. The next question, I think we have time for just a couple more. Is it hard to diagnose ADHD and anxiety if a child has sleep apnea but is non-compliant with CPAP usage? Jennifer, it is. That can be a little difficult. However, here's the caveat to that is some of the ADHD medications, the stimulants in particular, can be used to treat the fatigue associated with sleep apnea. Additionally, sometimes that will get kids over the hump when they start feeling a little bit better to engage with some counseling, and sometimes we can figure out why that child is not amenable to CPAP. Sometimes it's just the machine. Other times it's the stigma or some other barrier. I never cease to be amazed why kids decide what they decide and what their barriers are. And so, sometimes getting them to feel a little bit better can open the door to exploring those other therapies a little bit better. Also, we do know that some of the medications like Ritalin and stimulants do have a mild antidepressant component to them as well. In hospice, patients who are suffering from agitation or depression will sometimes prescribe a stimulant because it works so much faster than a typical antidepressant medication would. So, in a child who is maybe suffering from the anxiety issue and the fatigue issue, sometimes the addition of a stimulant can get things moving enough for us to clarify what the issue is. So, that would definitely be a more unique situation, but I think there are some options moving forward that you could discuss with your physician. The next question is, how can affect not to give medication to a kid or teenager with ADHD? I'm not sure I understand that question. Let me see if I can understand what you're asking. If you're asking how can you justify not giving the medication, well, we'll use that because I think it's a valid topic. I think it's a parent's choice to treat or not to treat. I think one concern that parents have is drug use, addiction, dependency. I think that's a valid concern because some of these medications are abused. What the data shows us is that when it is prescribed by someone who knows what they're doing, the safety profile of these drugs is excellent. I also think that when we take the time to explain to kids why they are taking the medication and how it works, again, I tell every kid, the meds don't make them smarter, they're already smart. I talk about the ADHD being a superhero power for them. You gotta have that discussion with them. And then oftentimes they'll engage or they'll try a different therapy. Going back to the dependency and drug issue, what we've also learned is that uncontrolled or untreated ADHD actually puts people at higher risk for illicit drug use. You would be shocked to learn how many people use cocaine as a alternative treatment for undiagnosed ADHD, or they'll use marijuana. Sometimes I shake my head when I'm in the gas station line and there's got the guy in front of me with 4 Monster drinks. I want to hand them our card because they medicate with caffeine. So I think the medications, it's a personal choice whether to or not to treat, but I think that safety-wise, I think treating is appropriate in a lot of cases. I think we have room for just one more. Let's see. Can ADHD medication be taken on a daily basis, or can it be taken just as needed? Depends which medication we're talking about. So if we're talking about a medication like Strattera or Wellbutrin, those are what we call steady state drugs. And those medications must be taken on a daily basis. If we're talking about a stimulant medication, then you have a lot more flexibility. So you could come off on holidays, breaks, weekends. There are a lot of options as far as how you take the medications. If you're on a tremendously high dose sustained, and then you start to go into this as needed status, you may have to wean that dose down a little bit first, and then you can go into that as needed status, but definitely an option with our stimulant medications. And also, this is, if we're talking to any college kids out there, this is where we want to talk about the different types of stimulant medications. So there is some convenience in the long-acting ones like our Concertas, our long-acting drugs, but there's also some flexibility in our shorter-acting ones. In addition to there being far less expensive, we are able to take shorter-acting medications to work into the schedule of that college kid. So if you have a class at 8 and then another one maybe at 5, you can take that shorter-acting one at 8. You don't need it during your break. You take it again at 5, and it's out of the system when it's time to sleep. So there is some flexibility, or actually I would say a tremendous amount of flexibility when we talk about prescribing the stimulant class of medications. So that wraps up our seminar. What a great discussion with all of our participants. I want to thank you all again for joining us for this webinar. Keep track of our webinars going forward. We have some great informational resources for our parents and for our adult patients. If you are questioning whether you have ADHD and are seeking an assessment, you can go to adhdonline.com, and we have some great resources as well as options for you to be tested. If you live in Texas or Pennsylvania or Florida or Georgia, we are now offering medication management by experts in ADHD that can give you some more information about which treatments would be best for you. Again, thank you for joining us. Have a terrific evening.